Before you leave the hospital, a nurse will review information you need to know for when you get home. You will receive paperwork called discharge instructions that will give you specific information about how to care for yourself after surgery and through recovery. During your discharge discussion, please ask your nurse any questions you might have. This is your time to help make your transition home easier. Most important, please follow your specific written discharge instructions to help facilitate an effective recovery. Information on swelling prevention, dressing incision care, bowel care, pain management, blood thinner, follow-up appointment, and activity is provided before you leave the hospital. We will review these in detail with you. For swelling prevention, use of ice packs and elevation will be helpful. Cold helps reduce swelling and relieves pain. We recommend ice and elevation 3 times a day for an hour each time. Swelling and bruising may get worse before getting better. This is normal. Monitor swelling and bruising. Notify your surgeon's office if anything seems out of the ordinary. The key to remember is more swelling equals more ice and elevation, and continue to do your ankle pump exercise. In caring for your incision, hand hygiene is important to prevent infection. If the following signs of infection occur, contact your surgeon's office. Skin that is hot to the touch or redness trailing around and down your incision. Temperatures of 101.5 degrees Fahrenheit or higher that last for more than 24 hours. Odor coming from your incision, increased drainage, cloudy drainage, or excessive bleeding. Please monitor your dressing for drainage that reaches the borders of your Aquacel dressing when it is on. If you have the Aquacel dressing in place, your dressing is waterproof and you may shower with your dressing in place. Be sure to pat the dressing dry after your shower. Remove your dressing as directed, typically 1 week after surgery, and then leave your incision open to air. Remember, no soaking your incision in water, only showering is approved. You may have steri-strips along your incision line. Leave these in place. They will be addressed at your follow-up appointment with your surgeon. After taking off your dressing, you should monitor your incision to make sure it does not spread open. Do this every day to watch for signs of infection. While taking narcotics, which slow bowels, we recommend the use of stool softeners, over-the-counter laxatives, and suppositories at home. Please exercise regularly and increase dietary fiber and water to prevent constipation. If you have constipation that lasts more than 4 days or gets worse, call your surgeon. When you leave the hospital, your surgeon will provide you a prescription for pain medication. You or your family member will need to go to your pharmacy to get it filled. Be sure to take pain medication as needed. We recommend keeping a log of when you've taken your pain medication. Your nurse will review your specific medications with you and when you should take your next dose. Your medications will be written out and included in your discharge packet when you go home. Post-surgery, you will be on some type of blood thinner, such as aspirin or some other form. Blood thinners are preventative treatment for blood clots. You will continue taking blood thinners at home. Be sure to watch for signs of bleeding from your incision, nose, and in your urine or stool, as well as any excessive bruising and prolonged bleeding times. If this occurs, notify your surgeon. Signs of deep vein thrombosis, called DVT, include localized swelling, warmth and redness of the leg or calf on one side, and pain that is noticeably worse when standing or walking. This occurs when a blood clot forms in one or more of your deep veins of your body, usually in your legs. If you have a blood clot in your lungs, you may experience shortness of breath or chest pain. Call 911 immediately. About 10 days after you leave the hospital, you should have an appointment with your surgeon scheduled. Please be sure to keep that appointment, or if you need to change it, call as soon as possible. If you have any questions before your follow-up appointment, be sure to call your surgeon's office. There will be someone on call to answer any questions 24 hours a day, 7 days a week. We encourage you to take short, frequent walks as opposed to one long walk. Do range of motion exercises at least 3 times a day. Limit your time with legs down in a straight-backed chair. When traveling, change positions or stand every hour, and perform ankle pump exercises. And please, no driving until your surgeon has cleared you to do so. We wish you the very best in your recovery. By being attentive to your health, following medical recommendations, and continuing activity as instructed throughout your entire recovery, you put yourself in a good position to meet your goals. Thank you for choosing Salem Health for your joint replacement.